Welcome to CIA Declassified. We are the deep dive audio experience that excavates the most protected secrets of the 20th century. Last time we tracked the electrical nightmare of the memory bridge. Today we confront the chemical equivalent, MK Ultra Subproject 130, codenamed the Sleeping Beauty Protocol. If electronics were too imprecise, chemistry offered a different approach, a pharmaceutical sledgehammer. Starting in the early 1960s, Subproject 130 was the agency's most aggressive attempt to synthesize a compound that would induce total, permanent, and targeted amnesia. The goal was quite simple: protect defectors, silence captured assets, or ensure deep cover agents could truly forget their origins, making them invulnerable to enemy interrogation. Subproject 130 emerged directly from the failures of earlier, more chaotic experiments involving LSD and other hallucinogenics. Those drugs were too unpredictable. They caused confusion, but they rarely led to controllable amnesia or reliable truth delivery. The focus shifted to powerful CNS depressants, drugs capable of putting the subject into deep dissociative comas. The key targets in the brain were the hippocampus and the amygdala, the seats of memory formation and emotional memory, respectively. The researchers believed if they could chemically turn off these areas during a critical period, the memories would simply fail to consolidate, leading to permanent loss. The CIA MKUL 130 CHEM report is a grim clinical record of the compounds tested. It is structured more like a pharmaceutical journal than a classified intelligence file. The central focus of Subproject 130 was the development of the Sleeping Beauty cocktail. This was a complex multi-stage infusion designed to be lethal in its imprecision but perfect in its result. It typically involved three key components. 1. High-dose barbiturates, used to induce a deep, controlled drug-induced coma, effectively suppressing brain activity. 2. Scopolamine, a powerful I'm not sure if I'm pronouncing that right, drug known to block the neurotransmitter acetylcholine, which is critical for memory formation. 3. The stabilizer, codenamed N7. This compound is the most heavily redacted section of the report. It was an experimental psychoactive agent, likely a benzodiazepine or synthetic derivative intended to stabilize the subject's vitals while maximizing the amnesic effect. Document quote, the combination of compound A and compound B achieved level 9 suppression of the hippocampal cortical axis, resulting in a 100% failure rate in all short-term memory consolidation post-injection, end quote. The amnesia was not simply passive, it was engineered. The operational protocol involved two critical steps performed during the subject's chemically induced coma. The event dump. The subject was subjected to continuous auditory loop of white noise or a specific high-frequency tone for 2 hours immediately following the memory target period. The theory was that the sensory overload would prevent the brain, even in its suppressed state, from sorting and consolidating the recent traumatic events. And 2, the suggestion lock. While in the deep dissociative state, the subjects were repeatedly given the suggestion that a specific innocuous event was the last thing they remembered. This was an attempt at false memory implantation to cover the memory gap. The logs indicate that the amnesia was often successful for the immediate 2 to 6 hour window, but the side effects were always catastrophic. The critical challenge was the lethal dose threshold. The dose required to achieve complete amnesia was often just slightly below the dose that caused irreversible respiratory or cardiac failure. The researchers were working with a razor-thin margin of error. The CIA MKUL 130 CHEM report contains multiple summaries of total system collapse. These sections are heartbreakingly clinical, detailing the precise dosage that caused respiratory arrest, the subject's autonomous breathing shut down permanently, irreversible comas, subjects survived the injection but never regained consciousness beyond a basic vegetative state, and fatalities. Several entries list subject termination, cardiac failure, 0.2 hours post-injection. These sections are often followed by requests for more sophisticated resuscitation equipment, indicating the team was essentially playing God with the subjects' lives. Another critical feature point for Subproject 130 was traceability. While the amnesia was effective, the drugs used, especially the barbiturates, left undeniable chemical signatures in the body for days or weeks. If a target died or was captured, a simple toxicology report would reveal the presence of massive non-medical cocktail exposing the CIA's involvement. The final phase of the project involved synthesizing an ultra-fast metabolizing barbiturate derivative codenamed the clean slate. This compound was designed to break down the bloodstream within minutes, leaving no traceable residue. The log entries related to the clean slate are the most fragmented, suggesting either the trials were brief and unsuccessful or the records were among the first to be destroyed. The CIA MKUL 130 Kim report is a heavily censored document. The volume of black ink on these pages isn't arbitrary. It reflects the highest risk areas of the program. The knowledge that, if exposed, could compromise ongoing assets or expose the medical infrastructure of the entire MK Ultra enterprise. We can hypothesize the purpose behind the most critical redactions. Compound N7, the stabilizer. The exact chemical structure and synthesis of this compound is entirely redacted. Hypothesis: this was the CIA's genuine novel chemical creation designed to enhance amnesia while managing toxicity. Exposing its structure would allow hostile foreign intelligence agencies to reverse engineer the unique memory wiping agent. 2. Specific institutions and doctors. All patient identifiers, exact locations of the clinics where the protocols were administered, and the full names of the supervising medical staff are censored. Hypothesis: this is an operational security measure designed to protect the professional careers and personal security of the specific doctors, hospitals, and universities that participated in these human trials. The clean slate formula. The final chemical formula and synthesis methods for the ultra-fast metabolizing clean slate agent are fragmented and often blacked out. Hypothesis: if the agency successfully developed a memory wiping agent that left no trace, that technology would still be considered a highly classified asset today. The redaction ensures the chemical knowledge remains solely within the agency. The dark chemical research of Subproject 130, much like the electrical work of Subproject 129, did not simply vanish. The understanding gained about how scopolamine and barbiturates interact to block memory formation via the acetylcholine pathway was later funneled into legitimate medical research. Today, similar drug protocols are used safely in hospitals to achieve temporary amnesia for highly painful medical procedures, ensuring the patient retains no memory of the intense pain. The CIA sought a weapon, but the underlying science eventually helped develop better, safer techniques for managing patient trauma. The Sleeping Beauty protocol is the ultimate evidence of the CIA's ruthless willingness to weaponize chemistry against the human mind. They traded permanent mental function for operational security. They sought to erase the secrets of the Cold War, but in doing so, they created their own terrifying history, permanently recorded in the cold clinical pages of the CIA MKUL 130 Kim report. We have exposed the agency's search for the ultimate cognitive poison. I'll see you in the archives. Remember to like this project and subscribe to the feed for surprises. We've explored the chemical and electrical hacks on the human body. Next time we explore the CIA's most bizarre and least believable venture, the supernatural. We open the file on MK Ultra Subproject 142, known internally as Operation Often, or the Black Mass Experiment. This program, active in the early 1970s, sought to weaponize the occult, testing the potential of black magic, rituals, and psychic manipulation for intelligence gathering and operational disruption. We examined the documents detailing contacts with genuine psychic mediums and alleged occult practitioners and the bizarre attempts to use curses or rituals against foreign targets and assets. The core file is CIA MKUL 142 Oculus Report, detailing how the agency seriously investigated whether magic could be a viable form of warfare. This is the unbelievable story of the time the CIA took black magic seriously. In the meantime, keep an eye on the shadows, mind your step, and question your memories. I'll see you in the archives.